When handling any instrument, safety and economy of movement is essential. Relaxed handling is required to avoid awkward movements. Safe and effective surgery requires correct and safe handling of all surgical instruments and sutures. Take time to acquaint yourself with the instruments provided, but don't concern yourself now with their names, as different hospitals use different instruments and even name the same type quite differently. Let us look at scissors. When holding scissors, don't use the finger and thumb because it's very unstable. Middle finger and thumb is slightly better, as the index finger can give a little support. Always hold the instrument with the ring finger and the thumb, with the middle finger behind and the index finger as close to the fulcrum as you can to stabilize it. And now you have complete control. If you're going to use it in a deep, dark hole, you can rest the scissor on the other hand in order to steady it. Don't put your fingers and thumbs through the rings, because that makes it difficult to get the instrument out of the hand. Always use the tips of the phalanges with control and also with better sensory feedback. Using the scissor in the right hand works well, whether held vertically or even pronated. But scissors are right-handed, and if you use them in the supinated position like this, they cut less well. Similarly, in the left hand, scissors being right-handed, they don't work very well vertically or pronated, but work much better if you supinate them. Hold artery forceps in the same way as we did with the scissors. Ring finger and thumb in the rings, finger behind, and a finger stabilizing near the fulcrum. To open the instrument, the thumb squeezes it closed a little first, and at the same time pushes the outer ratchet outwards, while the ring and middle fingers pull the inner ratchet inwards, and the instrument opens and closes easily. If I transfer the instrument to the left hand and hold it in the same position with the left hand, then I can't open it unless I force my thumb and fingers to move in the opposite direction to what comes naturally. And as a result, control of opening is poor. And in addition, there is pressure on the digital nerve, which can be very painful with a prolonged operation. So hold the instrument between the distal phalangeal pads of the thumb and index finger and use the ring finger to push up on the ratchet and open the forceps in a controlled manner. When opening the artery forceps, try to avoid them flying open with escape of the bleeding vessel by ensuring that the ball of the middle finger catches it as it opens. Oh dear. When holding a curved artery forceps, the curve should be facing inwards towards your operating area. Only occasionally is a clip held like that. The difference between a hemostat and a needle holder is that in a needle holder the milling is a diamond crosshatch pattern, which will grip needles. It has a toughened insert at the end of the blade. There are two classes of forceps, toothed and non-toothed. The milling on the tip of non-toothed forceps goes straight across from side to side and won't hold a needle securely. Surprisingly, the non-toothed are more traumatic, as more pressure is required to grasp tissues, causing crushing, and reserve the non-toothed for tubes such as blood vessels, gut, ureter, and for tissues such as liver and spleen. So use toothed forceps as the default option. Tooth forceps have teeth at the end for grasping tissue, and some have a special milled area which is diamond hatched and will actually grasp a needle, and these are often called abdominal forceps. DeBakey's forceps are more specialized with vertical milling and will actually hold a needle as well as perhaps being more gentle on the tissues. When holding forceps, don't hold them in a power grip like this because they're level with the tissues and parallel, and it's more difficult to pick tissues up. Hold the forceps like a pair of chopsticks like this, and you can actually get down into the tissues and pick them up more accurately. The scalpel. First choose the size of the blade you want. This small blade fits on this small handle, the size 3, while this large blade fits on the larger handle, size 4. Make sure you use the right handle for your selected blade. Open the packet. Make sure that the angle on the blade matches the angle on the handle. Use a heavy hemostat to pick up the blade from the pack, just where it goes wider. Do not go across the key slot, because then you won't be able to get the handle on the blade. And never go right across the blade, as you will cross the cutting edge and make it blunt. So mount the blade on the hemostat, take it out of the pack, pick up the handle in the left hand, and slide the blade down the slots in the handle halfway. Now move the hemostat to the wider part of the blade, but not across the edge, and push it on firmly until it clicks. In order to remove the blade from the handle, always aim the blade downwards so that no one will be injured if it flies off. Then bend up the heel of the blade and move it forward a little so it's resting on the edge of the slot and the blade is partially off. Now place the hemostat on the blade and remove the handle from the blade, not the blade from the handle. Immediately place the blade in the sharp spin, or if required later, in a kidney dish. Whenever a scalpel is passed between two members of the team, it must be passed in a kidney dish.